Hello and welcome to the Heywood Healthbeat, a program that helps you get the pulse on health in our community. Today we're joined by the President and CEO of Heywood Hospital, Heywood Healthcare, Wynn Brown. Wynn, thanks for coming. I appreciate you being here.
Thanks for having me here today. It's always a pleasure to be here.
And there's so much going on at Heywood Hospital. First and foremost, Heywood has a real significant presence in the North Central Mass area. What does that mean from your perspective? What is, really what is the presence of Heywood, the effect it has on the community? Tell us a little bit about that.
Well, first of all, I think we are the largest employer from Westminster all the way to 91. So we have a big economic impact because we employ so many people and at good paying wages as well. So in healthcare, the wage scale skews higher because of the technical and clinical skills that people have and the training that they have. And so overall, we pay fairly well, and that goes into the economy. The other piece is that we have been expanding our presence in our region. As you know, we are opening a new family medicine practice in Orange in January. We've expanded into Ringe with a specialty practice. We have a brand new practice on the Athol campus in their new Hillis building with more specialists, and we can talk about that. So we have been expanding our services, including we can talk about behavioral health as well. So providing more services in our region so that people can stay local for their care and not have to travel. And we are a lower cost provider, so it keeps the cost of healthcare down if you get your care locally. And if you need something beyond what we offer, we can get you where you need to go.
I'm always amazed to hear that stat that Heywood Hospital is the largest employer from Westminster to 91, and that obviously has a significant impact not only on the region but certainly the communities that we reside in. It's cool to hear about expansion in New Hampshire, in the Ringe area, and in Barry, and in Orange and Athol. Tell us a little bit more about what that expansion means to people who are trying to get their care. Why a specialty office in New Hampshire?
Well, a specialty office in New Hampshire is that there are a lot of people that live in Massachusetts or live in Massachusetts, work in New Hampshire, or are from Massachusetts. They live in New Hampshire, have a New Hampshire insurance, but work down here and want to be able to get their care locally. So we've worked hard to make sure that we now have all the New Hampshire insurance plans. So if someone from New Hampshire wants to get care here, we can take them now. Historically, we really didn't carry much of the New Hampshire plans. And there's also a need for the services in that region. So when you get up to Ringe, access especially to orthopedics, to OBGYN, and to addiction services, there's a vacuum in that region. And so us going up there is really providing services to folks who wanted to come to us historically but couldn't, and also expands our geography as well. And also primary care is right down the street at the Winchendon Health Center. So we've been going out to the edges of our market to make sure that folks who want to come to Heywood or to Athol or to the Quabbin Retreat or to one of our medical practices have that access. And so we've been incrementally growing our platform.
You mentioned Barry, Orange, and Athol as well. Tell us a little bit about what's going on specifically in Barry and Orange.
So in Barry, UMass has a health center in Barry, but we provide the cardiology services there. So our cardiologists are there 1 day a week providing cardiology services closer to home, so those Barry patients from the Barry area don't have to go to Worcester to see a cardiologist. They can see one of the Heywood cardiologists.
Neat.
Those cardiologists are also in Athol as well, because when we built the new Hillis building, we have a new primary care practice and we have a specialty care practice there as well. And so 5 days a week we have cardiology at Athol, so people from the western part of our service area don't have to travel. Again, don't have to come to Gardner or go farther to see them. We have rheumatology there, surgery, gastroenterology. We have our specialists that go there, not 5 days a week, but enough to provide coverage so folks can get their care in Athol now. And so if you're in Orange, you just have to go to Athol. You don't have to come all the way to Heywood for everything.
To go to Gardner or Greenfield.
Right.
There's a lot going on at Athol Hospital. There was a big expansion. the construction of the new emergency room and specialty office. Tell me a little bit more about the impact that that's had on the community, and specifically, what were some of the things that were done by Heywood Hospital to expand services physically, kind of physical footprint
Sure.
of the hospital?
So when Athol came into the family about 8 years ago, it's hard to believe
Wow,
that we're coming
yeah.
up on 8 years of that marriage of the two hospitals, and it has gone very, very well. Athol had a very old physical plant. As it had struggled to keep operating, it had not invested in itself. And so when we came along, we began immediately investing in the physical plant to make sure that it has a more contemporary care setting. So renovations, multiple years of renovations throughout the hospital, and then we just finished the 52,000 square foot Hillis building addition there. And so what that means now is that Athol has a state-of-the-art facility, really the envy of just about any community hospital in New England.
Beautiful. It's absolutely
Beautiful main entrance, covered drop-off, 12,000 square feet of primary care and specialty care. On the top floor, we have CSO, which is a behavioral health care partner in that region, and they have 12,000 square feet of behavioral health care right on our campus. So that really improves the access, which historically is very difficult to get behavioral health access in rural settings. And so they're our partner on that campus. And then, of course, we have a new ER. And that new 13-bed ER, is 4 times the size of our old ER.
That's incredible.
All private bays, brand new radiology suite. That we have a brand new CT scanner in that suite as well. So if you need a CT scan, it's right on site. And coming up in a couple weeks, we are going to open the new imaging center, which we did in renovated space in the old ER. So mammography, ultrasound, X-ray, CT, all right there, all in its own suite. What happened historically at Athol is that at the lower level was radiology, and you walked through a public hallway and went into X-ray or went into ultrasound, and kind of everybody knew where you were going. There was no real privacy, and now we have a fully private suite, and we're bringing the MRI around the building so that it is adjacent, because we have a mobile MRI there right next to imaging. So, in just a few weeks, Athol is going to make that final leap to that contemporary care setting. We still have some renovations to go, but we are incrementally getting those done as well. And if I think it now has become the pride and joy of that community. Yeah. And if you drive by, it's almost getting hard to get a parking space at Athol. It is that busy these days.
Isn't that awesome?
That
I mean,
awesome.
Really, when you think about folks that live in these rural communities that sometimes, we describe as deserts for care, that in Athol, we were able to create and provide this state-of-the-art facility for healthcare and for these residents and their citizens and family and friends. I think that's just so really awesome. One of the other things I think that is incredible is the new primary practice office.
Right.
Can you tell me a little bit about that?
So we have 3 new primary care physicians, or relatively new primary care physicians in the past year in the Athol area. So Drs. Cruz and Dr. Duda are practicing on the Athol campus, and Dr. Cruz is also fellowship trained in addiction medicine. So that is really helpful to us. He provides Suboxone treatment for some of his patients and groups there, and also at the Quabbin campus. And so we've been expanding that role with our primary care practices to make sure that we provide access to Suboxone treatment throughout our primary care network. So we have them on that campus, and then that expansion also goes forward to Orange with Dr. Ashley Warner's practice opening, I believe it's January 16th in Orange at the West River campus. And so we will have really a fantastic, very experienced primary care provider. And the western part of our service area has been wanting for a long time a new primary care provider out there so that they have some choice. And so she's going to be out there. And so that is just another step in that right direction. And then, of course, we can't forget that it's just a few years ago that we opened Tully Family Medicine and walk-in care, which really is a state-of-the-art practice, beautiful practice setting, and we have walk-in care, urgent care on that campus 7 days a week as well. That did not exist before, right? So we have definitely made moves to make sure that we, to the best of our ability as a community provider, round out our services and provide access. And to provide a care setting that people are proud and comfortable to go to. We believe that everybody in our service area should have access to very talented providers in Class A office settings and care settings, and that we should not have anything substandard just because of our rural nature. And so you have seen really us being very methodical about our expansion. When you walk into any Heywood practice, any Heywood facility, you know you're at Heywood because the look and the feel is something familiar to you because we have the same standards across all of our facilities. And so part of that is we want people to feel comfortable and feel at home. And so when you walk into anywhere of any of our facilities, you know you're at Heywood. And that is comforting to people because they're out of their element when they come to the hospital, right? Most people aren't coming excited to go to the hospital, right? They're coming because they're concerned about something. And so whatever we can do to make it a better experience, and a lot of that has to do with the training of our staff, but also the milieu in which you're being cared for.
Two very old primary physical plants, Gardner and Athol, historically very old. The renovations at Athol are just unbelievable, and I think that people in the community are so overwhelmingly grateful that they now have this kind of state-of-the-art facility that makes them feel, even though I think our practitioners have always been good.
Right.
That's one thing about Heywood Hospital. You know, I've received my care there. Our 3 daughters were born at Heywood Hospital. I mean, it's our hospital. I've always been very confident in the care, but not necessarily always confident in the facilities.
Right.
As it gets older, we need to renovate. And so Heywood's been doing a lot of renovations. We also picked up the Quabbin Retreat. Can you talk a little bit about the Quabbin and what that's doing for healthcare in North Central Mass?
Sure. So the Quabbin Retreat, we started developing that about 4 years ago, maybe 4 or 5 years ago. And the first two major things that we've done on that campus was 20,000.
Well, tell us a little bit first, what is the campus?
So the campus is 82 acres in Petersham. It was built originally in the 1920s as a summer mansion. And then in the 60s, a religious order purchased it and expanded it to be a regional mother house for their order. But as with most religious orders, over time their membership had declined. And so they had put that property on the market, and it had sat on the market for a while because it was just so big that everybody who looked at it was a little scared off, I think, by the size of the property. It's 75,000 square feet.
That is large.
You know, it has had a nursing home wing, a dormitory, commercial kitchen, incredible physical plant. And so it worked out perfectly, I think, for us. So the first thing that we did was we renovated 20,000 square feet, and McLean Hospital is our collaborator on that campus, and they moved their NOCAG addiction treatment program from Ashburnham there on that campus to, a space that's like 4 times the size of what they used to have. So it's a state-of-the-art residential addiction treatment facility for adults. And then we have a wing at that property right now where we provide outpatient counseling and Suboxone group, and then we have SOAP program, so outpatient treatment for people dealing with addiction, and our telebehavioral health services are based there. So a pretty active campus. We still have about half the campus to develop, and we're working on those. It's a little early to talk about those plans, but we are actually deep down the track on some new plans to provide behavioral health and addiction services in addition to what we're providing on that campus right now. And so, in 2020, there'll be a reveal on what our next steps are on that campus. And so it's a great place. It is a very bucolic setting. It's a very therapeutic setting. It's away from the hustle and bustle of a lot of places. Yet it's actually, it's just over an hour drive from Boston if you're coming from that far. So it's far away but close by.
Yeah.
Which is a lot of our service area.
It's really not far, and you're exactly right. It's just this unbelievably majestic campus, and it's nice to be able to have the resources, the physical plant, the footprint, to be able to add services as we identify and need them. So it's nice to be able to be at that place, right? Right.
And we use it also as a conference center, as you know.
It's very busy.
We have the chapel there is a very large hall, and so we do a lot of our training for the hospital there. The Chamber of Commerce has used it. Starrett uses it for some employee meetings because it's so large. It is a place where we provide regional training as well around behavioral health. And so it is actually organically becoming a regional hub for education and gathering. And out there, it is the largest gathering spot available. And we also do have a commercial kitchen. So we can cater to groups there. We don't put it out there right now as that, but I think you're going to see some more of that in 2020 happening, as well as that regional center where education happens around behavioral health and addiction.
Visionary. Visionary is really what I call the procurement of the cooperative
Right.
trade. It really just, again, satisfies so many needs today in our community. You talked a little bit about telehealth being present at the Quabbin. What is telehealth, and why are we engaged
Why are we
in
doing it?
Yeah, why are we doing it?
Well, we're telehealth is really, I think, the next emerging piece of what's going to happen around behavioral health and specialty care, and providing those consultative services one-on-one or in a group setting with a patient or patients remotely. And because we are rural in many senses, the access to specialty providers, especially behavioral health providers, is somewhat limited. And so we have been, through a multi-year grant, $1 million grant, been providing behavioral telehealth services into 3 of our high schools. And so I think we right now have 90 kids in 3 high schools getting therapy once a week. And the outcome of that telebehavioral health is amazing. The kids are more engaged, they're getting the support that they need, their families getting the support they need, they are staying in school, their grades are better, behavioral issues are lower, and we are also seeing for the first time, and I think it plays a role in it, and again, it's just a moment in time, but our overall suicide rate of adolescents is down in our region as well. And that's a piece, I think, of that difficult puzzle we've been dealing with, and it really is turning out to be fantastic. The challenge is, as you know, Massachusetts is one of 10 states left in the country that has not passed legislation requiring the payers to pay for behavioral health services.
Yeah.
A few of them are paying a little bit here and there, but we really need the legislation on Beacon Hill passed. And once that happens, we will be able to, provide telebehavioral health services probably to all of our schools, right? And then think about getting other specialty care right in your primary care practice. You go see Dr. Nodelson at Tele Family Medicine and you need your neurology consult. We schedule it right there at the practice and you have it right there because you've already got an established relationship with your neurologist and you don't have to travel. So that is where we're going, and that will just incredibly increase access. But you got to get paid for it. We have a very high public payer mix in our health system. We are one of the lowest commercially paid health systems in the Commonwealth. And so, we are profitable, but we run on a razor-thin margin because we run very lean. I think we're very smart about our expenses. We're very strategic about the services we put in. And so, I say we are solidly a middle-class health system. So we're good, but we don't have a deep bankroll.
Right.
And so we have to be very careful what we do. We would love to have telebehavioral health services and school-based health centers in every school. But again, we have to figure out how to get paid for those services. And so I think it's very exciting for us. And we are a leader in the state around telebehavioral health services. Recently, we had our staff do a demonstration on Beacon Hill for the legislators. Wow. We are on a panel for the Mass Hospital Association in early January, one of 3 health systems. We're the only Massachusetts health system being highlighted. Others are coming from away, but we have done really an amazing job and our outcomes are fantastic. So we can't wait to have that grow into even more.
It's an exciting time to be part of Heywood Healthcare. There's
It
just
is.
so much in the terms of the physical expansion and the real focus on providing care in the community where people need it. And we are a community hospital, and this is really supporting that philosophy and ideology of being, the place where people come to get their care locally.
Right.
And, I'm going to put in a gratuitous plug for that. I think that's
You
so
are going
important.
to put a gratuitous plug in?
I'm going to put in a gratuitous plug. There are people talk about, globally well-established healthcare systems in Massachusetts. That there are just a number. I think Heywood Hospital would absolutely would compare to any other healthcare facility in the Commonwealth for the care that most people receive.
Right.
Are there some very unique kind of specialties that we can provide? Sure, but that's rare. The vast majority of the healthcare that folks need on a day-to-day basis or year-to-year basis, we give, and we give exceptional care because we have great people. You talk about facilities. I'm also going to just mention how proud I am of our facilities crew. Mm-hmm. How the great work they do, although there are a lot of challenges for them. What do you see as being the most significant challenges physically for Heywood Healthcare?
So we have a couple big ones. The largest ones right now are actually on the Heywood campus. And so we have 2 major projects that are we're preparing to roll out. One is a behind the curtains, behind the scenes that no one will really see, but we live on a very old infrastructure. Our boilers date back to the 1950s, right?
Wow.
Our chillers, our air conditioning systems are patched together. Our energy infrastructure is very dated. And so that means we have a lot of repair work going on all the time to sort of keep our systems running. It also means that we spend a lot more money around energy utilization than we need to. And so we are right now going through a full assessment with Siemens, and in about March we are going to have a full plan and designs to go redo all of our energy infrastructure. It's in the end, it's about a $20 million investment at Heywood, and it'll allow us to save about, including incentives and rebates, about $1.4 million a year. That's the savings that we can garner by being more energy efficient, actually pay for the debt that we need to do that. But we will also be able to island. So we have our solar array. We're also going to have we have a $1.8 million grant from the state for a battery. So we'll have think about resiliency. So we'll have a big Tesla battery out back, and we're going to have a cogeneration plant. So we'll be able to generate actually about 3 meg of power, which is our power consumption. So if the grid goes dark or we have a big power interruption, we will be able to manage an island by ourselves, but it also will allow us to decide which types of energy to use depending on peak demand, to be smarter about utilization of the grid or not being on the grid. And so we will be really we will go from a very old plant to one of the most technologically advanced plants in a hospital in New England, quite frankly. And so that's one of the reasons the state came forward and made that grant for us around resiliency, because they've seen the work that we've been doing, especially around being green. We could have a whole other conversation about how we've greened our organization, and this is yet another piece of it by using less of a fossil footprint on the work we do. So that is one project. That's going to take about 2 years to get done. The other is really coming forward with a new surgical platform for our hospital. Right. We are, as you know, extremely busy on our surgical platform. We sprint 5 days a week to get all of our surgery in. We run incredibly efficiently. But our ORs were designed in the 60s and built in the late 60s, early 70s. So while they're functional, they're very small. And so back then, they didn't think of the technology and everything that we would have in a community setting. And so we are working on a new ambulatory surgery center that will be on our campus. We have a couple locations. Yeah. So because 95% of the surgery we do is day surgery. People come in, they have their endoscopy or they have their knee surgery, they go home. And so we run on a big inpatient platform. And what we really need is to transition, like you see in other communities, in especially more urban areas, of a freestanding surgery center that is much more efficient. And so that's what we're working on right now, and we hope to have that planning all done by the end of the year and then being in the ground in 2021. Wow. So that is the next big heavy lift.
And that's big. I mean, that's huge.
It is a huge lift. So, and how do we do that? We have a very thin margin. We're profitable, but it's not a huge profit margin for given hospitals and health systems. So we have the ability to borrow money. We have the ability to raise money. Don Cassavant leads us in our philanthropy program, and we've been very successful in raising money from our community. We need that investment as well. Athol's campaign for its project is, I think, $120,000 from being completed of its $3 million goal. And so we still have to complete the Quabbin campaign and the OR campaign for Heywood. And so those are our big, the big ones that people see. There's, as you know, projects every day around quality of care, and patient satisfaction and smaller renovations that we do. But that is the one the community is going to see. The other piece of the expansion is looking at our parking situation. We sort of live in this crescent of land, Crystal Lake on one side, Green Street on the other, and we have smatterings of property. And so our plan is actually, part of this overall plan is we now have a new city council seated. And so in the new year, our plan is to go to the new city council with a parking plan, because we're going to need some support from the city to make that work. We're a victim of our success. Because we are growing, people are choosing us, our parking is incredibly tight, and we run out of parking on certain days. And we just did a major parking study with New England's leading parking study group, Walker Consulting. So we have the data to go with it. You know, some people drive by and think, oh, there's parking. Well, at certain times of the day there are, but there are certain peak times and shift crossovers and things.
There's a lot of time during
There's
the day.
a lot of
no
time. You know,
parking.
people don't realize that we have upwards of 75 students a day during the school year as well on our campus. So they park there all day. You know, it's a very dynamic thing. It's not just a single snapshot of time. So we really need the city's support to help us continue to be successful.
And how many employees do we have?
We have 1,500 employees, 1,000 of which are on the Heywood campus.
That's incredible. I mean, it just, again, you think about the impact that has on a community. And certainly there are justifiable concerns, but I would suggest that the leadership in the city would want to encourage continued growth and success of Heywood, and they've been pretty practical in
They have.
in that
Well,
sense. We've
we're
had a great partnership.
we're a good citizen. We're a clean industry.
Right.
We're high paying overall in our jobs, and you know, what do you need to be a successful city? You need a great school system, right? You need a library, and you need a hospital. If you have those three things, along with the other things that go with, that makes Gardner a city.
Right.
And so I think, you know, having a very strong, and I should also throw in the college as well, but, you know, we have some gems there, and you need those key things to be solid to support your property values, you know, your tax base, your school system, not to mention all the things that we actually do from our weekend backpack food program.
I was going to get
to
that.
We do a lot of things to support our community, and the city overall has been incredibly supportive of us over time. And so it's been a great partnership, and so we're going to have to go back to the city again and say, here's a long-term plan for our campus to be able to operate the way we need to be and keep these services in the city. Can you work with us on that, and how can we partner on that? And I think we'll be able to find a way to do that really solidifies the strength of the hospital campus, you know, for the next decade or more.
Yeah, and it's interesting. It's going to be a great journey, I think, to go and talk about what these expansions. I wasn't aware that the energy efficiency project was upwards of a $20 million project. That's huge. I mean, you think about and trying to get those renovations done in a very old kind of footprint building.
I know.
But remarkably, every day you go in and you just see services, and you feel the facility's clean and it's operating.
Right.
And again, you know, I'm going to give kudos to the staff who really make things happen just extraordinarily. It goes to the point that healthcare is complex.
Right.
It's not just simply about having a doctor in an office.
Right.
There has to be all that planning in terms of facilities, and you talked about having to get the insurances from New Hampshire in order to provide services there and expand the footprint to an area that's challenged, that's, you know, kind of a remote area for healthcare. Right. So that's an important consideration, and the complexity of facilities and certainly the complexity of human resource management. But you're doing, from a hospital perspective, it's more than just providing care. We're doing a lot in the community. Can you talk a little bit? You mentioned briefly the backpack project, some of the other things we're doing, like one of the big things leadership has been very supportive of is Handle with Care. Why is that so important? Why are we doing it?
So I think Handle with Care goes to our overall strategy of investing in the future of our youth, right? So we have school-based health centers in the at the Winchendon School, at Murdoch School.
Talk about that.
We have one at the new ACES School in Athol. We have care coordinators in a number of our schools beyond just the 3 schools that we provide telebehavioral health services in, really as adjuncts to the guidance counselors, so that kids get the care that they need and the coordination of care. And you look at our weekend, we have over 300 kids every Friday going home with a backpack of food, because we have huge food insecurity. And that is a national model that we've adopted, and I want to say I think we're in our 5th year of that, and it is completely funded by Philanthropy. So the community funds that. Wow. Really, really quite amazing. So we're really focused on kids so that they have a good start. And so the latest program that we have launched is called Handle with Care. It is a national model, most closely to us in Manchester, New Hampshire. We have a very high prevalence of childhood trauma in this region, the highest about in the state, where kids are victims of trauma and then no one knows about it. And so how do we support these young kids that witness or experience abuse that everybody knows how to handle them with care. And so we have been training our law enforcement on it, our school leaders on it, our care providers, our physicians and our advanced practice providers, to identify those kids early on that are victims of trauma, who are victims of abuse, so that their care providers know something's going on. And so the simple example that I use is there is a domestic violence situation going on in a household. The police come, there are young children present, and the next day those kids go to school. Their school nurse doesn't know anything about it, their teacher doesn't know anything about it, their primary care physician knows nothing about it. And so this kid comes to school traumatized, perhaps acts out, people don't know what's going on, or perhaps they're withdrawn. This is a system that allows everybody who needs to know that these kids need to be handled with care. So,
and only that, the details of the trauma aren't shared, right?
not necessarily shared, aren't shared widely, but they know, and there's also a way for the child to self-identify, because they're given a card that says, they say, I need to be handled with care. And so everybody knows about that, so that those kids have a chance to be supported.
How cool is that?
It is incredibly cool.
That is.
So it takes a lot of money to do that, again, but we have a really great philanthropy office, led by Don Cassavant and Mary Gianetti, and we have, brought together grant funding to support this program and its launch. And I think, we are. It started out maybe looking patchworked, but now it kind of looks like a brilliant orchestration of a number of programs to support our youth, so that, we look back 20 years from now and the health status of our community is demonstrably better. Why? Because we took care of the kids when we needed to. They make healthier decisions as they grow up. They're supported as they grow up. They're making better food choices as they grow up. So it's a long-term play for us, and that is the beauty of being, I think, led by a community board of trustees who's invested, right? And so they see what needs to be done, and they're willing to take the risks to get those things, to support those things. And I think that is the beauty of Heywood, is our flexibility to think long-term and do those things. And then, the devil's in the details of figuring out how to pay for it, right? And so we've done a pretty good job so far.
Yeah.
And we're in it for the long haul, right? This isn't the flavor of the month. This is what we're playing for the long game. And I don't think there is a health system in New England, at least, that is doing what we are doing. The depth of what we're doing, the comprehensiveness of what we're doing, and the long-term commitment to what we're doing. And I think that probably more than anything makes me proud of the work we do. You talk about people coming and choosing Heywood. Our quality matches and rivals others. Our patient satisfaction matches and rivals others, right? The rating agencies, Joint Commission just came for our triennial survey for Medicare. The best survey we've ever had. We're not perfect, but we are firing on almost every cylinder in a way that is a high-performing organization that I think sometimes is I don't want to say underappreciated, but undervalued of what's really happening inside of all our care settings. And people can get their care locally and be confident in it.
Yeah. What an incredible statement right there, to just remind folks that people can get their care locally and be confident in that care. That's the bailiwick of Heywood Hospital. Just really exceptional care providers, care team, and support personnel, staff that really make sure that all the things that need to happen. Now, we gleaned over ever so quickly the community-based, school-based community health workers and the school-based community health centers. Can you talk just a little bit about that?
So we have two school-based health centers. One is at the Murdoch School, which we have had for
It's been a while.
18 years, and we have been supported by the state from the beginning on large multi-year grants, because we don't really get paid much for those services. And so we have a nurse practitioner there and a care coordinator along with the school nurse. And we also have a social worker based at that school. I think last year we did 1,200 behavioral health visits at the Murdoch High School and junior high school alone. So on-site versus tele, right? Tele-behavioral health services. And so this fall, there's a new elementary school in Athol, the ACES Elementary School, and so we have established our second school-based health center there with an advanced practice provider and also a care coordinator in that school. So, that is a fantastic model. If we could figure out how to financially do that in all of our schools, we would be just leaps and bounds ahead of everyone else. But again, There's only, you got to pick and choose where you can make those investments. And then, and then we also have our telebehavioral health services at 3 of our high schools. And there's a care coordinator there. And then Gardner, we have other schools, including Gardner, has a care coordinator, really making sure that as an adjunct really of the guidance office for kids who need some level of support, whether it's behavioral health or other services or the family needs services, really making sure that there's a coordination that happens so that the needs are met of the student and their family. Just another role we're playing.
How awesome is that?
Yeah.
How awesome is that? Especially, we talk about not necessarily having access to care all the time. You have a kid and you're working 40 hours, 50 hours, 60 hours a week trying to make ends meet, and finding that time during your day to get to a practitioner is difficult. To have those community-based, school-based community health centers there, and that care being able to be provided to our children.
Right. And we live in a world of 2 parents working as well, so that makes it even harder. And so that was one of the reasons that we went forward and opened 2 urgent care centers, right? So we have one here in Gardner, and then at Tully we have walk-in care there, because we needed 7-day-a-week access. And so when you go there, even though you might not be seeing your primary care physician, they are part of the Heywood Medical Group, right? And so if you have your primary care physician in the Heywood Medical Group, it's all in the same electronic medical record. So all that information's there. And if you come from the outside, we send that information to your primary care physician as well, so that they have that, that next day.
Boy, there's no really good reason for folks not to get their care at Heywood Hospital.
I can't think of one at all.
Or come work for us. We talked about that healthcare generally provides higher wages, good quality jobs, and a real diverse selection of jobs. So really, it meets a lot of needs of folks and interests of folks in the employment arena. We're doing some really neat things for our employees as well at Heywood Hospital. Can you talk a little bit about some of those neat things we do and give people a reason to come work for us?
Well, this is the pre-holiday week, so of course we have our holiday celebrations where we have meals. The management team serves meals to everyone. You can't see my pants on camera, but I've got, today is festive sweater day and festive outfit day, so I've got, gingerbread pants on and a festive sweater on the side. It was a little too sparkly for today. So we celebrate the holidays and do those kinds of things. But we have also very strategically and deliberately this year done a lot of work around training our staff on standards of service, and really how do we treat one another, and how do we treat our patients, and how do we communicate. And so our program is called Communicating with Heart. And it is based on the Cleveland Clinic's service model. The Cleveland Clinic, is considered one of the world's best health systems, and has some of the highest staff engagement scores of any health system and the highest patient satisfaction scores. Wow. And their process of training and keeping staff engaged resonated with our care values as a health system. And so we trained 24 of our staff, frontline staff, to be trained in how to provide, and you're one of them.
I am.
Yeah, one of our heart trainers. And we trained all 1,500 of our staff and our medical staff as well on our standards of behavior and how we interact with one another and how we treat one another, right? And now we have our always behaviors. And you can palpably feel the difference in the hospital of how people treat one another, how we communicate with one another, and now we're in that sustaining mode of that continued investment in it. And our number of complaints is down dramatically to almost nothing, because I think now our staff are equipped with the tools, right? You might have gone to school a long time ago for one skill, but maybe you didn't learn how to communicate as well as you could. And so we're giving people those skills so that we can provide an even better care experience and a better work experience for everyone. And so we're committed to that for the long term, as you know. I think we did 90 trainings so far this year across the health system. And we now do every new staff person who comes on board on their onboarding gets trained in heart. We also train, and as you know, you are our trainer, around suicide awareness. So we do that training for all new staff because of the suicide epidemic in our region. And that goes beyond our campuses, because they have those skills in their community to identify the signs and symptoms of suicide and what to do. And I think that is just another piece of the puzzle as well. And so I thank you for being really one of our great educators on our campus.
Heywood has always been a good place to work, receive good care, and I'm not saying that just as an employee. I'm saying that as a dad, as a spouse. My mom received care there for many years. Getting to this ideal of world class seems like we have made the leap for sure. We've always been a great place,
Right.
but now it's just this real investment, individual investment by each of our staff to ensure that we are a world-class rated facility. So that's exceptional work. Lots of stuff going on at Heywood Hospital. You talked a lot about the capital expansion. Really exciting things happening for the future of Heywood Hospital and Heywood Healthcare on all our campuses. Lots of geographic expansion, service line expansion, new practitioners. Just seems to be continually complex and ongoing. So I congratulate you on a very successful, certainly the year or last couple of years, and the expansion of our services. Stay tuned, ladies and gentlemen, for more to come on what's happening in Heywood Healthcare all around the North Central Mass area, and be engaged, be part of that. I encourage you to come to Heywood. If you haven't been a patient there recently, come to Heywood and check us out and see the services that are available for you and for your family. This has been the Heywood Healthbeat with Wynn Brown, Executive President and CEO of Heywood Healthcare. Thank you for taking the time.
Thank you for having me. It's been a pleasure. I
We'll be back
appreciate
again
it.
next month.
Thank you, everyone.